It's no secret that healthcare is facing a severe staffing shortage, especially among nurses. More than half of the hospital nursing force across the country is over age 50. But no one expected burnout from the COVID-19 pandemic would drive nearly a third of nurses to retire, leave the profession, or find traveling nursing positions that paid more. Now that fallout is hitting close to home.
This isn't a decision about dollars. It is truly a decision about staffing.
University hospitals will close the inpatient and emergency departments at both UH Richmond and Bedford medical centers. Those services will be consolidated into the expanding Ahuja Medical Center, 6 miles from Bedford, and UH Lake West, 6 miles from Richmond. Nearly 600 employees will be impacted.
None of our employees are going to lose their jobs. Every single one of them is critical to the system. There are literally hundreds of jobs that we need to fill across the system, and everyone will have a home, and they'll be given choice as to where they go.
UH says the two centers are the smallest and oldest in the system. Bedford opened in 1928, Richmond in 1961. But because of the staffing shortage, they've decreased capacity significantly.
We had close to 50 beds in each of those, 50 to 60 beds in each of the facilities. Back in October, as we were in the peak of a COVID crisis and we were facing significant staffing challenges, we actually reduced the number of beds at each of those facilities down to 14.
Today, University Hospitals has more unfilled caregiver positions than at any other time in our 156-year history. We currently have more than 3,000 job openings system-wide, including nearly 1,000 bedside nurses.
What will stay? The Behavioral Health Center at UH Richmond will continue, and doctors' offices will remain.
All of our doctors will still be there. Patients will still be able to access the doctors the same way they did before. There'll be the same faces in the same places.
We hope, depending upon where the individual patient lives, that the disruption will be minimal. At the same time, we intend to invest in new programs and new services for Bedford and Richmond Heights that will match the specific needs of these communities,
such as health education and screenings, grief recovery, workforce development, and food for life markets. Meanwhile, like other hospitals in Ohio and across the nation, they're figuring out ways to attract healthcare workers. They've partnered with colleges and universities to train personnel, offer tuition support, and better pay. But it may be years before they can replace what the pandemic took away. Monica Robbins, 3 News.